Republicans say Obamacare is a disaster. Democrats say that the GOP plan is DOA, or dead on arrival.
So joining us on 4-1 Forward is Dr. Sheldon Wasserman, a gynecologist and former Democratic state lawmaker, and now a Milwaukee County supervisor. You wear a lot of different hats.
Yeah, definitely.
Thanks for being here. So what's missing from the current debate happening out in D.C. between the Republicans and Democrats when it comes to health care and controlling the costs?
You know, the problem that's taking place right now is we have a bill before us that has kind of the skeleton of what this program is, but we don't have the rest of the body. We don't know what we're getting in this thing. But what we do see is trouble. We see problems already. Maternity care, eliminated, gone. It's no longer required. 12% before the Affordable Care Act came out, women were taken care of. Now it's up in arms. Are they going to be covered? Or are they not going to be covered? This was a guarantee. The other issues, you had everything to do with public health, immunizations, pap smears, mammograms, covered, eliminated right now. So even in the skeleton that's up there right now, we have problems. There's no guarantees. And what is, we've been told, oh, well, in the second phase or in the third phase, they're going to be able to revise it. But when I sat in those offices this week, and I was in Washington on Tuesday, I sat in our two senators' offices, I sat in two congressional offices. Everyone kind of puts their hands up in the air, and this is coming from Republicans. They don't know what's in it. They don't even know what the second or third phase is. What does the public say when even our own congressmen don't know what's in it?
So, Dr. Wasserman, you talked about a lot of guarantees that are now up in the air with this present plan. The plan also doesn't talk about lowering drug costs. And when we talk about cost and what's pushing premiums up, a lot of it comes down to people can't afford the medication they need after they get the diagnosis, especially when we talk about women's care.
This alarms people. This scares people. When it comes to healthcare, you want certainty. When you go to the doctor's office, you want to know what the plan's going to be. How am I going to get better? You're either going to have surgery, or here's the drugs, here's what we're going to do, we're going to get you better. When I sat in those congressional offices, there was no certainty. It was up in the air. And it's the healthcare of America we're talking about. People want certainty, and when you don't know what your future is going to be, are you going to have insurance? Are you going to have those drugs? Are you not going to have those drugs? What do? It's a panic.
Well, as you know, the argument is that there's uncertainty with the Affordable Care Act, that people saw that the competition wasn't there. In some places, there was only one insurance carrier. So do you agree that there were issues and problems with what is known as Obamacare that needed to be fixed and changed?
Absolutely. Obamacare needed help. Affordable Care Act, Obamacare, right, yeah. It needed help. And those fixes had to come. And the next president, either way, was going to have to fix something.
So what are those fixes, and are they in any of the GOP plan?
We don't know what the GOP plan is.
But I do want to ask, though, you mentioned something when you said, look at, there's these certainties or uncertainties that we're not seeing. It is a plan in process, but I think the thing that's confusing is that a lot of times GOP says more competition equals more or greater access to affordable care. Is that true?
Sometimes yes, and sometimes no. I mean, we don't have details. The one detail we do know is that for senior citizens, their rates are going to go up 5 times.
Disproportionately when you think of it.
I mean, how can we just take, sure, they are older. They are probably more unhealthy. That's the way it is.
They probably have less money.
But they also have less money, and they're going to be stuck with the bill. And is that fair? I mean, where do the subsidies? Obamacare needed fixing. It needed changes. We definitely need more insurance companies in. We need more competition in the marketplace. That needed to be there, but we also need subsidies. There are some costs in providing care for the citizens of our state and our country. But where are those costs best used? That's where the changes were going to come. But now, we're throwing the baby out with the bathwater.
All right, so what about younger patients? Do they need to buy in? Does there need to be the mandate to have the younger folks there?
People much smarter than I did said that they needed the mandate. If there's a way around it, sure. Should government force people to do things against their will? No, you don't want to. But at the same time, is it better for our overall health, or is it better for our overall economy? Yes, it is, because when young people are involved, they will not only save themselves from tragedies when they get that horrible diagnosis, but they typically are healthier, and they will lower the premiums for the senior citizens.
But Charles, can you explain to me, when we say younger, if kids are already being able to stay on their parents' insurance until 24, what is this group
26,
26?
right.
What is this group we're really talking about as far as
So
younger?
when you get 27, 28, 29.
Exactly.
Hopefully you're in the marketplace. Hopefully you have a job. Hopefully you have a job and you have employer insurance. But you're
Right.
still saying the younger, how do you get them to buy in?
But that smaller employer, let's say that new startup that wants to be, you know, an adventure firm that's starting in Milwaukee, you know, 15, 20 employees, even 5 employees. They're not providing. There's no forcing, there's no mandate that they have to pay for insurance for those employees. So these young kids, relative, I'm an older guy, but you know, these young people are not taking the insurance, and they're the ones who have to be in the marketplace.
Plus, their parents may not have the insurance that they could be on until they're 26.
Right, but they would also be in that 50 to 64 group that would have to pay
Yeah.
extra.
All right. Thank you very much for coming in and sharing your insight.
Thank you for having me.
All right.